I ultimately chose Natrelle because I wanted an implant that just felt like me. Like I always tell my little sisters, I don't need to look like a supermodel. I just want to look like me. And I felt like I was able to achieve that with Natrelle. When I shared my decision about my breast reconstruction with friends and family, quite frankly, I don't think that they were surprised because they know that I love fashion and I love beauty, and I obviously, wanted to have a look that made me feel great, and obviously wanted implants that looked great in no matter what I wore, whether it was a cocktail dress or a cozy sweater or a bathing suit. So they were all very supportive in my decision and certainly not surprised. Words of wisdom, I think, for a woman that is going to have breast reconstruction is that I think it's incredible what the medical community has been able to do. It really defied all of my expectations. It exceeded all my expectations, rather. I never really knew about breast reconstruction until I was sitting with my breast surgeon talking about it. I remember flipping through the book of before and afters and thinking, okay, but having now been on this side of it, it really is incredible. And I think that you will be surprised with the results. You can definitely, I think, be closer to the original look and feel of your breasts, that you can really achieve that look with implants. I would say my biggest advocates are my parents. My mother, having been a breast cancer survivor, like I said, she was an incredible support every inch of the way, from, me being afraid that I'm going to die to, oh my God, I'm going to be ugly with no hair. I mean, she held my hand as a child and she held my hand as an adult, and she continues to. And my dad is like my biggest cheerleader. He was there for every chemo treatment. And I think that's something as a parent that you shouldn't have to do, but he did it. And I wouldn't be here without them. And not only have they supported me through my health journey, but they have been there for me with my crazy cancer fashionista idea every step of the way, from me being like, Dad, what do you think of this logo, to, Mom, can you try this foundation? I want to make sure that it's really good. So they've just been an incredible force for me. I think what it means to be a self-advocate is actually harder. I think in some ways it's easier to, support other women, but I'm almost a 7-year survivor now, and I think that every day I need to remind myself to advocate, to take care of myself, to take the yoga class, to meditate instead of diving into the emails. I think it's a work in progress, and it's something that, I think we all need to try and chip away at each and every day as much as we can. My main goal as a breast cancer advocate is to lift women up when they feel completely defeated. I always say, I am not saving lives, but taking good care of yourself and using clean beauty products and, putting lipstick on when you're about to go to chemo, it's not going to change your outcome, but it certainly makes you feel better. And why not be able to live a happier, more fulfilled life, even through some of the really tough times, if you can? And that's really what I'm trying to do. There's nothing more defeminizing than breast cancer. When a woman loses her hair and her breasts, you feel powerless. And what I've learned through my own breast cancer experience is you can get your power back. You can get your power back by making choices that are right for you. And that doesn't just mean your implants or the type of surgery that you get. It's in your life in general. It's just totally regaining your power. And I think that that's something that I really try to instill in the women that I talk to every day with my own daughters, is that breast cancer can happen to you, but doesn't have to define who you are, and it certainly can't take your power away.
Natrelle Breast Implants, important safety information and approved uses. Breast implants are not considered lifetime devices. The longer people have them, the greater the chances are that they will develop complications, some of which will require more surgery. Breast implants have been associated with the development of a cancer of the immune system called breast implant-associated anaplastic large cell lymphoma, BIA-ALCL. This cancer occurs more commonly in patients with textured breast implants than smooth implants, although rates are not well defined. Some patients have died from BIA-ALCL. Patients receiving breast implants have reported a variety of systemic symptoms, such as joint pain, muscle aches, confusion, chronic fatigue, autoimmune diseases, and others. Individual patient risk for developing these symptoms has not been well established. Some patients report complete resolution of symptoms when the implants are removed without replacement. Who can get breast implants? Natrelle breast implants are approved for the following: breast augmentation for women at least 22 years old for silicone-filled implants, and for women at least 18 years old for saline-filled implants. Breast augmentation includes primary breast augmentation to increase the breast size and revision surgery to correct or improve the result of a primary breast augmentation. Breast reconstruction. This includes primary breast reconstruction to replace breast tissue that has been removed due to cancer or trauma, or that has failed to develop properly due to a severe breast abnormality. This also includes revision surgery to correct or improve the result of a primary breast reconstruction. Who should not get breast implants? Breast implant surgery should not be performed in women with active infection anywhere in their body, women with existing cancer or precancer of their breast who have not received adequate treatment for those conditions, women who are currently pregnant or nursing. What should I tell my doctor? Tell your doctor if you have any of the following conditions, as the risks of breast implant surgery may be higher: autoimmune diseases, example lupus and scleroderma; a weakened immune system, example taking medications to decrease the body's immune response; planned chemotherapy or radiation therapy following breast implant placement; conditions or medications that interfere with wound healing and blood clotting; reduced blood supply to breast tissue; clinical diagnosis of depression or other mental health disorders, including body dysmorphic disorder and eating disorders. Those with diagnosis of depression or other mental health disorders should wait for resolution or stabilization of these conditions prior to undergoing breast implantation surgery. What else should I consider? There is a boxed warning for breast implants. Please see bold text at beginning. Many changes to your breasts following implantation are irreversible. If you later choose to have your implants removed and not replaced, you may experience dimpling, puckering, wrinkling, or other cosmetic changes, which may be permanent. Breast implantation is likely not a one-time surgery. The longer implants are in place, the greater the potential risk for complications. You will likely need additional surgeries on your breasts due to complications or unacceptable cosmetic results. Thus, you should also consider the complication rates for later revision surgery, since you may experience these risks in the future. Cancer treatments and surgery will affect the outcome and timing of breast reconstruction. Breast implants may affect your ability to breastfeed, either by reducing or eliminating milk production. Rupture of a silicone-filled breast implant is most often silent. Even if you have no symptoms, you should have your first ultrasound or MRI at 5 to 6 years after your initial implant surgery, and then every 2 to 3 years thereafter, regardless of whether your implants are for augmentation or reconstruction. If you have symptoms of or uncertain ultrasound results for breast implant rupture, an MRI is recommended. Additional imaging may be required depending on your medical history and status. The health consequences of a ruptured silicone gel-filled breast implant have not been fully established. Routine screening mammography for breast cancer will be more difficult, and implants may rupture during the procedure. Perform self-examination every month for cancer screening and ask your surgeon to help you distinguish the implant from your breast tissue. Lumps, persistent pain, swelling, hardening, or changes in implant shape should be reported to your surgeon and possibly evaluated with imaging. What are key complications with breast implants? Key complications include reoperation, implant removal with or without replacement, implant rupture with silicone-filled implants, implant deflation with saline-filled implants, and capsular contracture, severe scar tissue around the implant. Other complications include breast pain, swelling, asymmetry, wrinkling, rippling, implant malposition, nipple complications, hypertrophic scarring, and implant palpability visibility. Talk to your doctor about other complications. For more information, see the patient brochures at www.allergan.com/products. To report a problem with Natrelle breast implants, please call Allergan at 1-800-624-4261. The sale and distribution of Natrelle breast implants is restricted to licensed physicians who provide information to patients about the risks and benefits of breast implant surgery.